Enhancing self-care of nurses is a project that I've been working on as a student of the California State University Doctor of Nursing Practice Consortium, and also with the American Holistic Nurses Association and the American Nurses Association to contribute to the Healthy Nurse, Healthy Nation initiative. Feel free to check out my first video on this project where I explain the research gathered on our current physical activity levels as nurses in America and how we can keep up with our physical activity goals. Nurses were found to be unhealthier than the average American in a study conducted by the ANA, which sparked my interest in helping to contribute to the movement and help to change this data. The American Holistic Nurses Association wanted to focus specifically on physical activity and figure out what barriers nurses face in maintaining healthy physical activity levels, as well as what factors can contribute to an increase in physical activity. Nurses often work in high-stress environments and can develop aches and pains from the daily strains of the job, which were all found to be barriers to physical activity. Research suggests solutions like wellness training and emotional support to help nurses gain resiliency in order to focus on their own self-care. So, what activities are actually involved in wellness training? There are several research studies that show the effectiveness of practices in mindfulness and how they can help us to manage stress and to be resilient whether we have emotional stressors or physical. Meditation is a mindfulness practice and helps you stay centered and aware of your thoughts and feelings whenever you are in a stressful environment. It can be done as little as 1 to 5 minutes at a time on the job. Meditation can also help nurses to be more aware of our thoughts and feelings about physical activity and what we may need to do to reach our goals. Another very popular mindfulness practice is yoga. Yoga can help with all of the above, staying centered, being aware of your movements, body alignment to prevent aches, pains, and injury. And also, it is considered physical activity under the muscle strengthening and stretching categories. So you can accomplish a lot with one 20 to 30 minute session. Research also suggests that healthcare organizations should provide a space where nurses can practice mindfulness activities like these. So nurses, feel free to advocate for these. Bring the research and show your leadership how focusing on these activities regularly can improve job satisfaction and improve patient outcomes. Health coaching is another activity that can help with wellness training. The American Holistic Nurse Association offers information about coaching, the benefits of receiving coaching, as well as benefits of having a nurse as a health and/or wellness coach. Health coaching provides a way for individuals to partner with the coach in order to work towards goals that focus on healing and overall well-being. Major coach principles include self-assessment, powerful questions, goal setting, and celebration. These principles have been shown to increase motivation for those being coached and also help with sustaining behavioral change. It is even better that nurses who are trained as health coaches may have the ability to help each other as well as their patients to stay on track with self-care behaviors like physical activity. It would also be beneficial to advocate for nurse coaches in your work environment so that nurses can have a coordinator or self-care officer on hand to ensure all nurses on staff receive the wellness resources that they need. As mentioned in my previous video, the American Nurses Association details the importance of having solutions like grand challenges as well as periodic challenges that can help bring individuals together to collectively set goals and change behaviors for the better. The Healthy Nurse, Healthy Nation website has several challenges that you can be a part of to either get started or continue on your self-care journey. As part of the Enhancing Self-Care of Nurses project, we also created a challenge to help get more nurses engaged and involved in taking steps toward reaching their physical activity goals. Be sure to check out our social media postings for more challenge details.